Leukocyte reaction, a severe reactive leukocytosis, usually with granulocytes, is seen in A. Afterburns, B. Severe infection, C. Acute hemolysis, D. All of the above. Correct answer D. All of the above. What is absolute value of neutrophils? A. 2500 to 10,500 per microliter of blood. B. 2500 to 9500 per microliter of blood. C. 2500 to 8500 per microliter of blood. D. 2500 to 7500 per microliter of blood. Correct answer D. 2500 to 7500 per microliter of blood. All the following are biological properties of virus except A. Natural host strength, B. Thermostability, C. Mode of transmission, D. Vector relationship. Correct answer B. Thermal stability. Viral DNA is generally replicated in A. The nucleus, B. The cytoplasm, C. The cell wall, D. The mitochondria. Correct answer A. The nucleus. For the diagnosis of HIV infection, the viral protein that is most commonly assayed directly is A. P9, B. P17, C. P24, D. P66. Correct answer P24. Ova of the Enterobius vermicularis is examined by A. Wet mount microscopy using normal saline, B. Wet mount microscopy using iodine solution, C. Rectal swab microscopy, D. Cellophane tape microscopy. Correct answer C. Rectal swab microscopy. VDRL or screening test for syphilis is termed as A. Flocculation test, B. Complement fixation test, C. Agglutination test, D. Neutralization. Correct answer A. Flocculation test. The most commonly used for screening tests of syphilis A. TPHC, B. RPR, C. VDRL, D. WR. Correct answer C. VDRL. The specimen for fungal culture on SJ is only A. Skin scrape materials, B. Small pieces of mice nails, C. Short segments of hair, D. All of the above. Correct answer D. All of the above. D value, decimal reduction value, is the lethal dose required to inactive A. 100% of initial population, B. 90% of the initial population, C. 50% of the initial population, D. 10% of the initial population. Correct answer 90% of the initial population. Sterilization by filtration is done for heat level or thermo level parenteral fluids. For this purpose, the filter must have pore size of A. Less than 10 micrometer, B. Less than 1 micrometer, C. Less than 0.45 micrometer, D. Less than 1 nanometer. Correct answer is less than 0.45 micrometer. How many types of penicillin binding proteins are there in the bacterial cell wall? A3, B4, C5, D6. Correct answer D6. Formation and development of RBC is known as A. Thrombopoiesis, B. Erythropoiesis, C. Hemopoiesis, D. Granulocytopoiesis. Correct answer B. Erythropoiesis. Azurophilic stain, purple color, seen in blood film. Staining is called A. Leishman effect, B. Wright effect, C. Zimsa effect, D. Romanowski effect. Correct answer D. Romanowski effect. Edwards syndrome is A. Trisomy 21, B. Trisomy 18, C. Trisomy 13, D. Trisomy 20. Correct answer Trisomy 18. Eukaryotes differ from prokaryotes in that A. Eukaryotes do not have organelles, B. Eukaryotes have a single chromosome, C. Eukaryotes have a nucleus and organelles, D. Eukaryotes do not divide by mitosis. The correct answer C. Eukaryotes have a nucleus and organelles. Substances move across the membrane of prokaryotic and eukaryotic cells by all the following methods except A. Active transport, B. Facilitated diffusion, C. Osmosis, D. Translation. Correct answer D. Translation. Acetyl CoA is not used for the synthesis of A. Fatty acid, B. Cholesterol, C. Pyruvic acid, D. Citric acid. Correct answer C. Pyruvic acid. The syndrome of inappropriate antidiuretic hormone secretion SIADS causes A. Low serum vasopressin, B. Hypernatremia, C. Urine osmolality to be lower than plasma, D. Low serum electrolytes. Correct answer A. Low serum vasopressin. The total glucose in the body is grams. A. 10 to 15, B. 20 to 30, C. 40 to 50, D. 60 to 80. Correct answer C. 40 to 50. Among the following, the most sensitive indicator of glomerular function is A. Serum urea, B. Serum creatinine, C. Urea clearance, D. Creatinine clearance. Correct answer D. Creatinine clearance. All the following statements about inulin are correct except A. It is completely non-toxic, B. It is completely filtered by glomeruli, C. It is not reabsorbed by tubular cells, D. It is secreted by tubular cells. Correct answer it is secreted by tubular cells. Maximum rise of serum amylase occurs in A. Acute pancreatitis, B. Chronic pancreatitis, C. Pancreatitis, D. Pancreatic cancer. Correct answer D. Pancreatic cancer. Chyluria can be detected by addition of the following to the urine: A. Sulfoxylic acid, B. Nitric acid, C. Acetic anhydride, D. Chloroform. Correct answer D. Chloroform. Among the following, a test of tubular function is A. Creatinine clearance, B. Inulin clearance, C. PAH clearance, D. PSP excretion test. Correct answer C. PAH clearance. Which one of the following tests is concerned with liver function? A. AST, B. ALT, C. ALP, D. All of the above. Correct answer D. All of the above. One of the following amino acids contributes hydrophobic properties to the protein? A. Serine, B. Leucine, C. Histidine, D. Tyrosine. Correct answer B. Leucine. Which one of the following is responsible for increasing the fluidity of the membrane? A. Stearic acid, B. Palmitic acid, C. Linolenic acid, D. Cholesterol. Correct answer C. Linoleic acid. Which photodetector is most sensitive to low levels of light? A. Barrier layer cell, B. Photodiode, C. Diode array, D. Photomultiplier tube. Correct answer D. Photomultiplier tube. Alcoholism, liver failure, and hypoxia induce acidosis by causing A. Depletion of cellular NAD, B. Increased excretion of bicarbonate, C. Increased retention of CO2, D. Loss of carbonic anhydrase. Correct answer A. Depletion of cellular NAD. The lipid profile test is used as part of cardiac risk assessment and includes A. SDL, B. LDL, C. Triglycerides, D. All of the above. Correct answer D. All of the above. Laboratory tests of hepatic functions includes A. Serum bilirubin, B. Urine bilirubin, C. Excretory function, D. All of the above. Correct answer D. All of the above. The storage of carbohydrate in glycogen form is found more in A. Liver tissue, B. Muscle tissue, C. Liver and muscle, D. Pancreas. Correct answer C. Liver and muscle. Which one of the following plasma glucose level is thought to be danger? A. 50 mg per dl, B. 60 mg per dl, C. 70 mg per dl, D. All of the above. Correct answer A. 50 mg per dl. Jaundice is markable when bilirubin level reaches a concentration of A. 0.1 mg per dl, B. 1.0 mg per dl, C. 2.5 mg per dl, D. 5 mg per dl. Correct answer C. 2.5 mg per dl. Oxidation of which substance in the body is the most calories? A. Glucose, B. Glycogen, C. Protein, D. Lipids. Correct answer D. Lipids. Which of the following is the reference method for measuring serum glucose? A. Homogenation, B. Hexokinase, C. Glucose oxidase, D. Glucose dehydrogenase. Correct answer B. Hexokinase. Following a head injury, which protein will identify the presence of CSF leakage through the nose? A. Transthyretin, B. Myelin basic protein, C. Tau protein, D. C. Reactive protein. Correct answer C. Tau protein. Blood and ammonia levels are usually measured in order to evaluate A. Renal failure, B. Acid-base status, C. Hepatic coma, D. Gastrointestinal malabsorption. Correct answer C. Hepatic coma. What is the absolute value of eosinophils? A. 40 to 414 per microliter of blood, B. 40 to 540 per microliter of blood, C. 40 to 640 per microliter of blood, D. 40 to 740 per microliter of blood. Correct answer A 40 to 440 per microliter of blood. Lymphocytosis is seen in a viral infection, EBV, CMV, rubella virus, etc. B. Chronic lymphocytic leukemia. C. Tuberculosis. D. All of the above. Correct answer. D. All of the above. Anisocytosis means A. Variation in shape of RBC. B. Variation in size of RBC. Variation in arrangement of RBC. D. Variation in size of platelet. Correct answer. Variation in size of RBC. Reticulocytosis is seen in A. After hemorrhage. B. Severe hypoxia. C. polycythemia. D. All of the above. Correct answer. D. All of the above. The best agent for dehydration is A. Ethyl alcohol. B. Methyl alcohol. C. Isopropanol. D. butanol. Correct answer. A. Ethyl alcohol. Which one of the following is not true about rotatory microtome? A. The tissue block is fixed in flat plane across the knife edge. B. It is most ideal for routine and research. C. It is excellent for cutting sections. D. The microtome is smaller in size than the sledge microtome. Correct answer. D. The microtome is smaller in size than the sledge microtome. Tilt or the incline of microtome knife is the angle between the surface of the block and the line which bisects the edge of the knife. The tilt angle varies between A. 0 to 9 degrees, B. 10 to 40 degrees, C. 50 to 75 degrees, D. 75 to 100 degrees. Correct answer. A. 0 to 9 degrees. Calcium non-chelating anticoagulant is A. Heller-Paul double oxalate, B. heparin, C. EDTA, D. trisodium citrate. Correct answer. B. heparin. Excess of EDTA can cause A. decrease in PCB value, B. increase in MCSC, C. swelling and disintegration of peroxide, D. all of the above. Correct answer. D. all of the above. The ratio of trisodium citrate to blood for PT test is A. 1:19, B. 1:15, C. 1:9, D. 1:5. Correct answer. C. 1:9. Concentration of trisodium citrate is A. 3.8%, B. 2.8%, C. 1.8%, D. 0.8%. Correct answer. A. 3.8%. Good luck.